Good morning, everyone. Today, we will be discussing the benefits of prenatal education for pregnancy and birth. As midwives, we encounter women during one of the most vulnerable and transformative periods of their lives. Education is already an integral part of our practice, as it occurs through our conversation, listening, explanations, and dedicated advocacy. But when prenatal education is approached intentionally, structured effectively, and made accessible, its impact extends far beyond individual births, ultimately strengthening families, communities, and healthcare systems. Throughout this session, we encourage you to reflect on your area of work and consider how prenatal education can be effectively promoted and integrated in the communities you serve. To begin, let's ask ourselves a question. Why does prenatal education matter?
Claire, can I ask you something?
Sure.
So you know I'm pregnant, right?
Mm-hmm.
And you recently had your baby. Well, I was on Google, and Google says my baby is the size of a pineapple this week.
Yeah, that sounds about right.
But my app says baby is the size of a coconut, and another app says baby is the size of a cabbage. So I'm not sure what's growing inside of me.
Well, this is exactly why I've told you should go to those prenatal classes at the hospital.
What? Do they do fruit comparisons?
No, but they explain things that actually matter, like what labour is really like.
Seriously?
Yeah.
Oh, I've done research on labor already.
Let me guess, on Google.
Of course. And TikTok.
Oh no, Lou.
Well, according to TikTok, labor can be very therapeutic with meditation, fairy lights, you know. Listen. And then it can be the extreme, where everyone is screaming, push!
Well, this is why the prenatal classes are really good to go to. They fall somewhere in between the two extremes.
But I already know the basics. I mean, there's pain, and then there's the baby. Poop.
I see, and let me guess, you've already started drinking your okra water to help the baby slide out.
What? How did you know?
There's a bit more to it than that.
Like what?
Like how to cope with the contractions, what positions help, when to go to the hospital, when to ask for help, what pain relief options there are, and what's actually normal during labour.
What? They teach you all that?
Yes, and they also talk about postnatal care and how to look after your baby.
You mean I need to know how to look after the baby?
Yes!
Seriously?
Yeah, that's a plan.
Oh my word. No, I don't think I can do that. That is so terrifying.
I know. But look, this is why the prenatal classes are there. They're there to help with that. They teach about feeding your baby, sleeping, how to tell when something's normal, or when you should call someone for help.
Oh, so less guessing?
Yes, exactly. Less guessing, less panic, and much more confidence.
I think that sounds good, because then I won't have to consult ChatGPT and Google at 3 a.m. if this is normal.
Absolutely. Trust me, future you will appreciate it.
Great, then. That sounds awesome, Claire. I will attend those classes.
Fabulous. I'll come with you. The hospital has free parent classes on a Monday night from 5:30 till 7, open to all the public.
Listen, as long as they don't compare my baby to any fruits and veggies, I'll stay.
Deal.
Pregnancy is more than a biological event. It represents a profound physical, emotional, and social transitions for many women. Unfortunately, this journey often begins with feelings of uncertainty, fear, and an overwhelming influx of information, whether it be from social media, apps, books, online searches, or friends. It can be conflicting or difficult to interpret. This is why prenatal education matters. It serves to transform information overload into clarity by offering reliable, supportive, and evidence-based guidance. Today, we will explore the benefits of prenatal education in optimizing patient care and improving outcomes in female reproductive health. We will review the evidence by demonstrating how prenatal education can improve maternal and neonatal outcomes, reduce anxiety and fear surrounding pregnancy and birth, support informed and shared decision-making, and promote equity and respectful women-centered care. So, what is prenatal education? Simply put, prenatal education, also referred to as antenatal education or childbirth classes, provides expectant parents with evidence-based information on pregnancy, labor, birth, and newborn care. The World Health Organization emphasizes the importance of prenatal education as a key component in achieving a positive pregnancy experience. This is accomplished by promoting continuous learning throughout pregnancy, birth, and the postpartum period, with information shared through one-on-one sessions, group classes, or digital formats. Prenatal education empowers women to make informed decisions about their care, and with ongoing educational support, this ensures they receive accurate and timely information, bridging the gap between clinical care and lived experiences. This helps them navigate each stage of their maternal journey, the good, the bad, and the opposite of pretty. Now, let's go through some of the benefits. Firstly, prenatal education improves pregnancy outcomes by promoting attendance at antenatal clinics and encouraging healthier lifestyle choices, including better nutrition, increased physical activity appropriate for pregnancy, and reduced substance use. These positive behavioral changes contribute to decreased pregnancy complications, such as gestational diabetes and hypertensive disorders. Research consistently shows that women who engage in prenatal education are more involved in their care, resulting in higher rates of attending scheduled appointments and following up on recommended screenings and assessments. Education enhances health literacy, enabling women to understand the rationale behind various tests, understand how lifestyle choices impact pregnancy outcomes, and recognize when symptoms are normal and when to seek medical attention. Show of hands if you've ever received a prescription with explicit instructions to complete the course of antibiotics, but didn't. Be honest. Okay, well, we all know medical personnel aren't the best patients, but when you grasp the purpose of recommendations, adherence improves, not through mere compliance, but through a collaborative partnership in your care. Next, let's look at the benefits of prenatal education on birth outcomes. By addressing both the emotional and practical aspects of labor and delivery, prenatal education significantly improves birth outcomes, with one of its primary benefits being the reduction of fear related to childbirth. This then increases the likelihood of spontaneous vaginal delivery. The educational content provided in prenatal classes covers essential topics such as the physiology of labor, helping women understand what to expect and improving their coping mechanisms. It also supports pain management options for vaginal deliveries, outlines the stages of labor, and introduces various birthing positions. By understanding the birthing process, parents can make informed decisions about their birth plan, feeling more prepared for the experience, aside from just drinking okra water. Yes. Systematic reviews indicate that prenatal education is associated with decreased rates of obstetric interventions. For instance, women who participate in prenatal education are less likely to experience induction of labor or cesarean deliveries for maternal requests when not medically indicated. Even when medical interventions become necessary, as labor and delivery can be unpredictable, women who are educated report a greater sense of satisfaction and a sense of control during their birth experience, despite the change in circumstances. Prenatal education has a direct and measurable impact on both postpartum and newborn outcomes, with effects that extend well beyond the birth itself. Women who participate in prenatal education are significantly more likely to initiate and sustain breastfeeding, especially when the education includes realistic preparation, guidance on positioning, and clear expectation setting. This is supported by the World Health Organization and National Institute for Health and Care Excellence, which highlight the importance of these elements in improving breastfeeding outcomes. In addition to this, prenatal education is associated with lower rates of postpartum anxiety and depressive symptoms. By preparing women for the emotional changes and role transitions that occur during postpartum period, education serves as a proactive factor for maternal mental health. This preparation helps women manage the challenges of early parenthood and reduces the risk of emotional distress. Education that addresses newborn behaviors, such as recognizing feeding cues, understanding normal patterns of crying and sleep, and practicing skin-to-skin care, builds parental confidence and responsiveness. This foundation supports early bonding between parents and infants and facilitates infant regulation, contributing healthier development, and smoother transition into parenting. Educated parents are better equipped to identify early warning signs in themselves and their newborns, including postpartum mood changes, jaundice, feeding difficulties, or signs of infection. This awareness promotes earlier help seeking and intervention, which can reduce complications and prevent emergency presentations. Collectively, these outcomes demonstrate that prenatal education is not limited to pregnancy itself. Instead, it plays an essential role in ensuring safe, confident, and supported early parenting, highlighting its value in fostering positive postpartum and newborn experiences. Okay, as you know, pregnancy is widely acknowledged as a period of significant emotional and psychological stress. Educating women and their families about the potential mental health changes that may arise during this time is crucial for ensuring holistic well-being. The World Health Organization reports that approximately 10% of pregnant women and 13% of women in the postpartum period globally experience a mental disorder, with depression being the most prevalent. These rates are notably higher in developing countries, where they reach 15.6% during pregnancy and 19.8% after childbirth. With this being said, prenatal education plays a pivotal role in supporting maternal mental health by boosting self-efficacy, improving coping skills, and helping women set realistic expectations for labor and delivery. Prenatal education serves as a proactive strategy for mental health rather than merely a source of information. This educational support can be delivered through one-on-one sessions or in group formats. Group sessions offer the additional advantage of fostering peer support, which has been proven to alleviate feelings of isolation, a common risk factor for perinatal mental health disorders. Involving partners in prenatal education has been shown to improve birth support and postpartum outcomes. Imagine being in labor and the person supporting you is unaware of how to assist. Instead of providing meaningful help, they choose to sleep, eat, and ask the most annoying questions at the most awkward time. Like, is that the baby's head? Knowing well they didn't help you shave. Now imagine that same person having attended prenatal classes and knowing exactly how to support you. Makes a difference, right? This collaborative approach not only benefits mothers, but also strengthens family bonds and support systems.
What about empowerment and shared decision-making? Prenatal education empowers expectant mothers and their families by promoting an improved understanding of their available options through the perinatal period. They understand their choices more clearly, such as pain management. Do they want pharmacologic or non-pharmacologic management? It's not uncommon to hear a patient say, well, my grandmother had all her children without using anything, and my mother did. And I want to do that also, but the prenatal education will help them to decide what they want. What about their labor positions and mobility? Induction and augmentation methods, modes of birth, vaginal assisted cesarean section, newborn care choices such as breastfeeding, safe sleep, skin to skin, VITK. Some mothers confuse VITK, they don't want it for their baby because they thought it's a vaccine. What about eye prophylaxis? This enhanced awareness is a cornerstone of meaningful informed consent, ensuring that decisions are based on a clear comprehension of the risk, benefits, and alternatives associated with various aspects of care. As the women gain deeper insight into their choices, they are better equipped to participate actively in their care. This increased participation fosters a greater sense of autonomy and control, encouraging women to advocate for their preferences and to be involved in care planning. The nature and purpose of the intervention, the expected benefits, potential risk and complication, reasonable alternatives, including if they don't want to do anything, and what might happen if they declined. What about their increased participation in care? Their goals are clarified for labor or treatment, choosing between the options, voicing concerns or values, practicing comfort measures, monitoring symptoms, and following through with recommended plan of care. For example, you have a woman with gestational diabetes. How is that woman able to follow through with the plan of the strict management that is needed to ensure safe motherhood? What about enhanced autonomy? This helps them to express their preferences for labor and birth and postpartum without coercion, without the emotional manipulation, and respect for the patient's rights to decline or change their mind. What does the evidence show? In a study published in the Women and Birth magazine in 2025 on the effectiveness of antenatal education and improving labor and birth outcome, this was a systematic analysis done in 17 countries, including Iran, Denmark, USA, Germany, Turkey, Ireland, Italy, and UK, just to name a few. They looked at 17 studies with a sample size of 7,260 women. And the results show that antenatal education was associated with decreased rates of planned cesarean section and increased spontaneous onset of labor. General education and birth plan care interventions were found to be more effective than specific techniques of care. In another randomized controlled trial of 2 antenatal education programs in the Journal of Midwifery, Vanessa et al. Found that postnatal perceived maternal self-efficacy scores were higher for those who attended the Having a Baby program. In 2021, Papa et al. On the influence of antenatal education and pregnancy outcome, another systematic review focusing on premiparous women, a total of 14 studies comprising of various study design was analyzed. What was the outcome? The outcomes assessed include fear and anxiety, delivery mood, postpartum depression, and self-efficacy. And it was concluded that these programs effectively reduce fear and anxiety associated with childbirth and enhance maternal self-efficacy, but it was inconclusive around postpartum depression. What are the best practices for effective prenatal education? As health professionals, we play a very critical role in reinforcing the values of prenatal education. We can actively recommend and promote evidence-based content to ensure that patients receive accurate and relevant information and not our own thoughts. We need to reinforce key messages. So during the prenatal visits, you should consistently reiterate important points to help the patient retain fundamental knowledge. Address individual concerns, taking time to discuss each patient's specific questions and worries promotes trust and personalized care. And sometimes you won't they might not come to you while you're doing the session, but let them feel comfortable that after the session, you're available so that you can have a one-on-one discussion with them. Interactive teaching. Provide opportunities for interactive sessions where patients can ask questions and include their partners, enhances understanding and involvement. What about dispelling myths such as the need to eat for two, or that exercise is dangerous and that morning sickness only happens in the morning? The delivery should be culturally sensitive, so you ensure that information is delivered in ways that respect cultural backgrounds and help to make the education more accessible. So it's good to know the audience. You're going to a new country, learn about the culture, know what is the people you are dealing with, the people you are working with, their likes and dislikes. The collaborative approach is super important, working together with an interdisciplinary team or a multidisciplinary team, including your midwives, your OBGYNs, your educators, your doulas, and this strengthen the support network for patients. The WHO stated that adults absorb information best when it is interactive and relevant and when it is delivered gradually over time. To maximize learning, it is important to avoid overwhelming patients with excessive information at once. Instead, try and use storytelling. Real-life examples can make education more relatable and memorable. Effective prenatal education should empower patients rather than create anxiety and fear. When education builds confidence, it contributes to improved clinical outcomes and a more positive patient experience, and I'm sure you would agree with me. So in your small or your big corner, what can you do? Now here are a few actions you can implement to improve care. 1, integrate education into your routine care. So you're seeing your patients, use it as an opportunity to do education. So as mentioned, embedding education within the routine prenatal care process ensures that every patient receives timely, relevant information. This integration supports consistent messaging and reinforces the importance of education as part of the prenatal care. 2, invite collaboration, as I mentioned earlier, so your health professionals, your midwives, your OBGYN, your nurses, your educators, non-governmental organizations such as the Cayman Islands Breastfeeding Support Group helps to create a supportive and comprehensive care environment. Working together, the team can address diverse patient needs and provide well-rounded educational experiences. 3, encourage policy and institutional support. So advocating for policy changes and institutional backing strengthens the role of the prenatal education within the healthcare system. Support at these levels ensures that educational initiatives are prioritized, resourced, and accessible to all patients. So if you're working in a facility, you're seeing antenatal patients, and you probably do not have a prenatal education program, this is a policy initiative. You can say, look at a few studies, talk to your persons in management and see if you can implement a prenatal education program, because the research evidence is there that it does help with safe motherhood and betterment for our families. 4, view patient education as a powerful tool. Patient education should be recognized as a vital instrument for improving clinical outcome, increasing patient autonomy, and promoting equity in care. By prioritizing education, healthcare professionals empower patients to make informed decisions and actively participate in their care. Prenatal education is more than an optional supplement. It is a clinical intervention with measurable benefits. Healthcare professionals have both the opportunity and the responsibility to incorporate education as a standard component of prenatal care, making it an expected and valued part of the patient's journey. Through education, you do more than simply just share the information. You empower patients to experience healthier pregnancies, achieve safer births, and build stronger families. This empowerment leads to improved outcome for everyone. So, what can we talk about in our prenatal classes? And we have a variety of topics that we talk about, that is important that we talk about for pregnant women. We look at their general health, and the women learn about maintaining overall wellness through pregnancy. And this basic component covers talk a little about the development of the fetus, the role of the placenta, the physical changes that the mother might experience, morning sickness, medication, and as you heard earlier, it is estimated that more than 10% of mothers suffer from postpartum depression, hence it's critical that it is addressed in the prenatal period. Genetics and physiotherapy covers common genetic disorders such as sickle cell disease is one of those, and of course for physiotherapy, your pregnancy, discomfort and relaxation exercise, because pregnancy can be one of the most uncomfortable period. Nutrition. Guidance is offered on healthy eating habits and lifestyle choices to support both mother and baby. It also covers diabetes in pregnancy, one of our most common conditions. Breastfeeding, super crucial as an aspect of newborn care, the benefits, proper latch techniques and common challenges, and dental care is also explored. What about normal labor and delivery? Provide information, the information provided regarding typical processes and expectation of labor and childbirth. Classes offer and cover pain management options, stages of labor, various birthing positions, and by understanding the birthing process, parents can make informed decisions about their birth plan, feel more prepared for the experience. We also do alternate methods of delivery, such as it might happen that they have to have a cesarean section, vacuum extraction, or forceps-assisted delivery. We also discuss postnatal care, what happened at your postnatal visits. Caring for your newborn can be overwhelming, especially for first-time parents. We also include basic instruction on newborn care, such as diapering, bathing, soothing techniques. Parents can also learn about the importance of bonding with their baby and recognizing signs of illness. Safety, the importance of immunization. I'm sure each year we see what's happening in the United States, different outbreaks of measles, etc. So immunization is very important. And of course, the methods of family planning. So we don't wait until you have the baby to tell you about family planning. We start in the prenatal period.
Okay. Now, please turn your attention to this short video showing the benefits of prenatal education.
Oh, yeah, for the Christian.
Hello, my name is Catherine Russell. I benefited from attending the prenatal educational classes by getting to see other local parents in the community, and also by getting to get real information from local experts in the field rather than turning to Google or somewhere else. I got to get local information that was personally applicable to me.
So leading up to the birth of our daughter, we attended a lot of prenatal appointments. I have to say the staff was very informative. They let you weigh out all the options, because some of the testing and things like that is not always mandatory. And, having a disability myself, some of those tougher choices, I'm glad that they were able to explain, the different routes and what happened if something came back and things like that. So my husband and I could make informed choices of whether or not we wanted to go through with certain procedures or testing.
Hi, my name is Shavante Johnson. I am the community psychiatric nurse for the mental health department. For the Parent Craft class, I educate mothers and their partners on how to support their mental health. The topic explored is postpartum depression. We believe that early education equals early recognition and encourages timely support and treatment. Oftentimes, we've recognized that mothers and their partners mistake the symptoms of postpartum depression for the normal baby blues. Therefore, increasing the awareness allows families to identify the risk much sooner. One of the most exciting things that parents and their partners get to look forward to is the tour of the maternity unit. Touring the maternity unit allows the mothers and their partners to see the environment that they and their newborns are going to be in. Therefore, this reduces a lot of anxiety.
The staff at Women's Health have been very helpful throughout this journey, and I really appreciate their support, their guidance, and ongoing advice. I definitely would recommend the classes to other parents, especially if they're feeling a little bit like they're going into the unknown. It helps a lot with feeling more confident before you take on this ultimate step in the journey of birthing.
I would absolutely recommend the prenatal classes to other expectant mothers or partners. I think it's beneficial for everyone, not only the person giving birth, but also, the partner. It's very informative, and again, the opportunity to ask questions, or in my case, a lot of things I learned that I'd never even heard of before, right? So it's good to have multiple sources, and I feel like not only are you learning new things, but you also get to meet other people that are on a similar journey to you, that you might, relate to and can chat to and hear about other people's experiences. So it's very good in creating a community as well, which is nice.
So just remember, prenatal education, when we look at the grand scheme of things, though we are on a small island, we are just 4 years away from the Sustainable Development Goals. And I'm sure you know which one we fall into. So we look at Goal 3, especially Goal 3.1 and 3.2. Thank you.
Can we put our hands together one more time for this excellent presentation by these ladies? I think we all can agree, highlighting prenatal education as well as access to that care is paramount to our quality of care for our patients. So thank you, ladies. In the interest of time, we will entertain 2 maximum burning questions. Yes, just 2.
Thank you for your presentation. It was really informative. I have one question though. I know that HSA, they offer home visits for postnatal care. I was wondering if I don't know if they offer home visits for antenatal care as well, since there are patients in the eastern districts like East End and North Side. So I was wondering if there is like a plan for the future to be more inclusive to those who might not have the means or transportation to reach women's health in order to receive antenatal care and education to help support their journey in pregnancy?
Hello, thank you. Yes, it is in the making. At present, we don't offer the antenatal visits, but it's a part of our plan. We do offer the home visits postnatally, as you mentioned, and we encourage the visits to antenatal clinic. We do have clinics in the eastern districts, which is easily accessible, but if it's a case where the patient can't go for some reason, they have our numbers. We're open 24/7, and we'll reach out to them if they can't make it in. Mike?
Please stand.
So that is one of the things that we're looking into as well, and that is in the making, in collaboration with public health, to offer a visit to antenatal patients in the Eastern District, especially our high-risk patients.
Thank you, Nurse-Midwife. Any more questions? No? Okay, thank you.